Hello again. This is Dr. Rockhold. Uh, this presentation is just intended as a little lagniappe, an addendum to the 4 segments on antidepressant pharmacology. What we're going to do in the session is to introduce a clinical case that totally changed how medical residents in the United States are trained, and in the process provide some clarification for the so-called serotonin syndrome, which is relevant to the many of the drugs discussed in this course and which you will have learned about also from other lecturers. First, the case. Libby Zion was an 18-year-old woman who was admitted to a New York emergency room with an unclear presentation in 1984. She died the next morning, and the case brought nationwide attention to a clinical syndrome resulting from drug interactions that previously had received little attention. The subsequent legal proceedings, the public concern, and ultimately legislative and medical society reactions are what brought the 80-hour resident work week rule into play. One detailed report of the clinical case, there are others, is provided in the link on this slide. I encourage you to read it. Interestingly, despite the attention given to this case, it was not until 2006 that the FDA sent an alert notice concerning the possibility that combinations of a triptan and an antidepressant from either the selective serotonin reuptake inhibitor, SSRI, or serotonin and norepinephrine reuptake inhibitor, SNRI classes could elicit the potentially life-threatening serotonin syndrome. This emphasizes how obscure this drug interaction was until recently. Recognize that numerous other drug combinations can increase synaptic serotonin in the central nervous system and elicit the serotonin syndrome. There are 3 sets of symptoms that characterize this syndrome. First are cognitive effects. These include restlessness or agitation, headache, and confusion. Autonomic stimulation occurs, presented by tachycardia, occasionally increased blood pressure, fever, sweating, dilated pupils, and diarrhea. And then the third set of symptoms include somatic effects, muscle incoordination, hyperreflexia, muscle twitches, which can progress to convulsions. And in the most serious cases, convulsions and fever can lead to rhabdomyolysis and or death. The link on this slide shares a YouTube video that presents the same history as that in the previous case report, but from a somewhat different perspective. You may find it interesting to compare the 2 reports. This slide provides a summary of the drugs and drug combinations that are most likely to produce a serotonin syndrome. By themselves, the SSRIs only rarely cause the syndrome unless they are ingested in significant overdose quantities. Clear dangers do exist when MAO inhibitors or tricyclic antidepressants are combined with an SSRI. Many of the opiates, specifically including meperidine and the cough suppressant dextromethorphan, may also trigger the syndrome in combination with an SSRI. You should recognize that significant illicit use of dextromethorphan occurs, and thus a drug interaction may not be immediately evident. Other drugs of abuse, like cocaine, are also potential causes of malignant interaction with an SSRI. And then finally, recognize that cyproheptadine, which is a specific serotonin receptor antagonist, is available, and it can be used to reduce the severity of the syndrome. So let me sum up by saying that this material is intended simply to emphasize the potential for drug interactions that can occur when agents that elevate brain levels of serotonin are combined. I think you'll learn more about the serotonin syndrome from other lecturers, and they may hold you responsible for more specific details. I also bring this forward to you because I think you'll find the history of this case and its implications for medical education interesting and relevant. I hope so, at any rate. I will not ask exam questions about this case, although you do need to recognize the syndrome and what drug combinations are likely to cause it. Thank you for your attention. Please feel free to email me with any questions that you may have. Goodbye.